important conversation. So ladies, listen up. How well are you taking care of, and how do you take care of your cervix? When it comes down to cervical health, what do we do? What do we know? And how do we get it done? We're going to be doing our self-care 101 with a very amazing obstetrician and gynecologist. I always wonder, I always make sure I'm saying it right. Because you can almost, it's like that with the medical, there's obstetrician, there's ophthalmologist, there's another one, honestly I can't remember. Quite a number of specialists in this space, and she is a specialist obstetrician and gynecologist, Dr. Lawrencia Serwaa Manu. Hi, Dr. Lawrencia. Thank you for coming. How are you?
I'm doing very well.
It's a pleasure to have you here. Now we're going to be going into self-care 101 and taking charge of our cervical health. A lot of people are under the assumption that how do you even take charge of caring for yourself right, and especially in that sense. So firstly, to understand, there can be complications related to your cervical health, and there are ways in which you can also either bring it to the minimum, or at least prevent it from actually happening at some point in time, right?
Yes.
But for those that do not understand, especially our male audience, what really is cervical health?
Okay. Thank you for having me once again. So, cervical cancer, as you know, a lot of talk is going around in the month of January. It's just cancer that affects the cervix. But you know, if you say cancer that affects the cervix, you need to explain what is a cervix, because it's a big word. It's a big medical word. So cervix is simply the mouth of the womb. So the womb we refer to as uterus.
Right.
That's like the technical or the medical term, but it's just the womb. So the mouth of it, that end point is what we call the cervix.
Okay.
Yeah. So if you have abnormal growth of cells on the cervix, then we say you have cervical cancer.
Yes. Okay.
So to elaborate more on the cervix is tubular. It has two main parts. It has a part that is outward, opens into the vagina. It's called the ectocervix. And this ectocervix can actually be seen during vaginal examination. So when your gynecologist opens up your vaginal walls, you can see the cervix. Even you as a female, if you put your hand in your vagina and go a bit further, you'll hit on something that feels, you know, a little firm, like the tip of your nose, and that is your cervix. So that's the outward part. And then it has a tubular part, which is called the endocervix, which serves as a conduit for blood flow during menstruation. And it's the same thing that opens up during childbirth for the baby to be delivered.
Right.
So basically, that is what the cervix is.
Okay.
So seeing where the cervix is, if you don't take care, if you don't pay attention to it, if you don't have a medical person examine you, you may never know what is going on with your cervix. And that is why talking about cervical health is very important this morning.
Absolutely. Now, speaking on statistics, is cervical cancer something that is very prevalent, especially in our local setting?
Yeah, I like that question, because cervical cancer is actually the second most common cancer in women.
What?
In Ghana.
No.
After breast cancer.
No way.
It is.
Are you serious?
That common. Yes. And to listen further, about 3,000 women are said to be diagnosed annually in Ghana. Right here in Ghana.
Are
New
you
cases.
serious?
Yes. And out of this 3,000, 2,000 of them died from the disease.
No way.
Every year. So that's how bad.
And it's caused by the HPV virus.
Very good. So this HPV is human papilloma virus.
Okay. And how does it come? Where is it from? How do you get it?
Okay, so it's a virus. Just like coronavirus, influenza virus, you can catch a virus. But this virus, you can get it through sexual contact.
Hey, wow. Okay.
Yes. So, and in a woman of reproductive age would definitely have sexual intercourse, no matter what, which means we are all at risk. Once you are having sex, you can have HPV. But there are other risk factors that makes the prevalence of HPV even more bad or worse.
Such as,
if you'd have poor immunity. Because you see, we all get viruses every now and then, but if you have good immunity, your body sheds it away. So when you get the HPV, it's either you get rid of it, your body is able to dispose of the virus, or you are not able to. So it persists on your cervix and causes changes that will eventually lead to cancer in future.
And there's a vaccine for it.
There is.
So now let's talk. Okay, so we've established the causes of it. Now, what are some of the symptoms of it?
Okay, so when we talk about getting infected with human papilloma virus, which is a sexually transmitted infection, you may not have any symptoms at all. Yes, you may not have any symptoms because, it's a virus. So you've gotten a virus, you are there, everything seems fine, but it's causing damage because if it persists, it may cause changes to the cervix that would be, problematic in future, But of course, if you don't do what is expected of you as a woman, regular screening, try to prevent yourself from, being too much at risk and all that, then you may have problems with the HPV.
Now, how is there a way to prevent getting HPV?
Yes.
Okay.
Yes. So we have the primary prevention, we have secondary prevention, and we have others. But what is of utmost importance is the first two. So primary prevention is basically one of the things I'm doing now, trying to create awareness, making people aware that something like this exists and what they can do, what information they need to access, where to go, what to do as a woman, and when. Okay. And then the other part of it is for very young children before they start sexual activity. It's expected that they get vaccinated against the HPV virus so that they don't even get the virus in the first place. So these are some of the things that you can do.
So the vaccination that doesn't need to happen before you hit the an age where you start having sexual intercourse, or you can do it at any point in time.
So the vaccine was actually established for people who have not had sexual intercourse before. So that is what the research was directed to. So they realized that when you haven't had, so we call it HPV naive, your body has never had contact with that virus, and you get vaccinated against it, the probability of it working effectively was very high. But that notwithstanding, they realized that a lot of people, the vaccine came much later. Meanwhile, we knew about this disease a long time ago. So what happens to the women who were not vaccinated when they were young? So that's when they started doing research to find out whether it could be beneficial to people who have already had contact with HPV. And they realized that it is better to have the vaccination than not to have it at all. So there is some benefit, even if you've been exposed to HPV in the past.
So it's encouraged for women to get the vaccine at all points in time. Now let's talk about the pap smear, because that's a test to figure out if you have. Explain what pap smear is to me.
Good. So when you asked me about the prevention, I said there's one part of it which is called primary, where we want to talk to people so that they know how to, the kind of partners they should, partners who don't have like very frequent, a lot of multiple sexual partners, and then try and have delay sexual intercourse and all those things, because these are all risk factors. The risk factors, I think I missed that point, where people who start having sexual intercourse very early are at greater risk. People who have partners with multiple sexual partners, or if your partner had a partner who was infected previously with cervical cancer, or if you have HIV, it means your immunity is low, and a whole lot of other things. These are all risk factors. Okay, so if you have these risk factors, what do you do? you would have to go on to the secondary prevention part, which I didn't talk about earlier. And this secondary prevention part is where we do the screening. So people who have already been exposed to the virus, what do we do for them? They've already been exposed. Those who have not been exposed, we can give them the vaccination. But those who have been exposed, what do we do? As I said, the virus may either be cleared or it may persist and cause havoc. So you would want to screen people, because cervical cancer is awesome in the way it is formed, because when you get the HPV virus, it takes a while before eventually it develops into cervical cancer. So it starts off by you getting the infection, no symptoms. Then it progresses to a point where you have certain abnormal changes on your cervix, which is not yet cancer. And that is why we need to do screening.
Right.
Because if we pick up these abnormal changes, that is not yet cancer, we can treat them so that they don't become cancer. Because once it becomes cancer, the treatment is more difficult. The survival rate is low and everything. Yes. So that's where pap smear and others come in. It's a screening method for people who are already exposed to HPV infection, who may be at different levels, either certain changes on the cervix or very early cancer changes on the cervix. So pap smear is one of the screening methods. There are other screening methods like HPV DNA testing, and we have other simpler forms of screening like VIA, visual inspection with acetic acid, where we apply just kitchen vinegar on your cervix and see if there are any changes. Just look at it, and if there are changes that are suspicious, we may either treat or we may either observe, and so on. So these are all pap smear, just as all the others that I've mentioned, are screening methods.
Okay. Yeah. Now, what are the treatment processes? Say you do a pap smear or any of the other tests, and you now realize that there's like some initial changes happening. What are some of the treatment options available? Very good.
So it's important to make the audience aware that there are treatments for these precancerous lesions. They are not yet cancer. They are precancerous lesions, and that's where we want to get the disease, because that's when our treatment is effective. That's when we get 100% cure, unlike when it has already become cancer. So when we do our pap smear and it comes out as abnormal, we will go ahead to do what we call colposcopy. Colposcopy is basically looking at your cervix under magnification, using a telescope or something to, magnify the cervix and then look at it very well to see certain changes. So during colposcopy, depending on what we see, we may decide to do what we call cryotherapy, which is basically using an instrument which delivers very cold temperature to freeze the cervix. So if it freezes the cervix, then it kind of destroys the cells that were about to change to, become abnormal later in future and cause cancer. So cryotherapy is one of those treatments. So using cold temperature. Then the other one is what we call thermal coagulation. Thermal means using high temperature. So this particular instrument delivers high temperature to kill the cells that are undergoing that abnormal changes, the precancerous changes. Kills it so that it doesn't progress to become cancer.
Are all these treatments available here in Ghana?
These treatments are available in Ghana.
Okay.
Then the other part is, depending on how bad the cervix looks after looking at it under magnification and painting the acetic acid, we may decide to cut that part of the cervix off so that you still have the whole length of your cervix to have children, to do everything that you want. So we want to get the disease at this point when it's not yet cancer, so that we can treat it, because the treatment options and methods are available to us.
Okay. Now, with these, are they done under anesthesia?
You don't need anesthesia. So, because you see, these are these are some of the myths and misconceptions that are going on, that pap smear and anything related to sexual health is so painful. It's rather uncomfortable, I must say. If in few instances we may need to give some form of pain relief here and there, but most of the time we do it with the patients fully awake, and
then they're good to go right after.
Good to go, Yeah, so if anything,
very
we just
interesting.
inject something on the cervix to reduce the pain.
Okay.
And then,
And then you're good.
You're good.
Okay. So now, so at what point does the vaccine come in? After you do a pap smear, then you do have HPV vaccine?
Of course, the audience who already have children in that age bracket where they have not started having sexual intercourse between the ages of 9 and 12, thereabout, the vaccines are available. You can go ahead and purchase it and get your warts vaccinated. But of course, if you're an adult, you've already been exposed to HPV in the past, what is advisable is you have to go and get screened. So we will screen you with pap smear, and then we will do an HPV DNA test. And if it's negative or if everything is fine, then we go ahead and give you the vaccine. But if you have certain changes, we treat, and then after that, we give you your vaccination.
Okay. Now, how do people make a booking? Is it something that you can just walk into any healthcare center and say, I want to get screened, I want to get tested, and I want an HPV vaccine?
Yes, so especially in this month of January, awareness creation and free screenings are going on in most parts of health institutions. So if you walk into any place, you should be able to access these services.
Okay.
But of course, throughout the year, there are places that are more active than others.
Such as
Kolebu Family Planning Units.
Okay.
Throughout the year, that is something that we do.
Okay.
Yeah.
So we'll find you where, Doc?
So you find me, Kolebu Family Planning Unit. I'm there.
Okay.
I may not be there directly, but of course I'm in the units, in the Obstetrics and Gynecology unit in Kolebu. But we have like that section where we do these things. The nurses are there. They will meet you if it gets complicated and they need me to come in as a gynecologist. I may come in, but the nurses basically are trained to do most of these things. Yes.
Because I'm just realized. So I've done a pap smear before, but and it was negative, so I didn't follow up to do the HPV vaccine, which is something now I'm actually deeply regretting. So I think I need to schedule an appointment and come through and actually get the vaccine and know that at least I can sleep better at night. Yeah, that's very interesting to know. So in this month of January, which is the focus is on promoting awareness and for it to last throughout the year, what is the one thing you tell a young lady about getting screened and most importantly getting tested?
I'll tell them that they shouldn't listen to all the misconceptions and myths that's going on. It's painful and a whole lot. I think they should just come and take advantage of, because now there are even free screenings. Sometimes, yes, the month of January, most places, like the first 50 ladies who walk in are getting free screening, and some places you have like half the price. The lowest you get is like 10% reduction in the price.
Wow.
So please, let's use the opportunity to get screened this month.
Is it expensive to screen?
It's not. So even without all these discounts, it costs just about 350 Ghana cedis per child.
Oh no, women, we're doing ourselves a disservice, because if up to 3,000 women are getting new cases every year, then for just 350 Ghana cedis, you can actually save yourself a whole lot of stress. Get screened and then go into treatment if need to, and then get the vaccine if need to. And I think honestly, too many times we play with our health. We assume that there's nothing wrong because we don't see symptoms, and that's why cervical cancer is very, very deadly, because you could have the symptoms happening and you wouldn't know it, you wouldn't feel it. So it's our collective responsibility to ensure that we all get tested, get screened, and then get treated if need be. But what are some of the stories, because being in the field and seeing it constantly, what are some of the stories that you hear, you see? Let's start with the stories, then we'll come into myths and misconceptions that people usually carry along with them that we need to maybe remove or change in the next few weeks.
Okay. So before I get into this story, we're talking about precancerous lesions that are not yet cancer. Okay, they don't show any symptoms, but when you already start having the cancer, you start having symptoms. And some of the symptoms are abnormal vaginal discharge. So most of the time, the very early stages, people have such abnormal discharge. And unfortunately, so this leads me to the story. Unfortunately, people would just go to the hospital or clinic and say that I have whites, I need treatments. And unfortunately, they may not go to like a gynecologist who would take, pain to look at their cervix. So they'll just get treatment or prescription for candida or whites. And then they go and they realize that after taking the medication, they're still having this abnormal discharge continuously. And they may even sort herbal treatment and all that. So by the time they get to us, the disease has already progressed. So these are some of the symptoms that, cervical cancer comes with. Abnormal vaginal discharge and then abnormal bleeding. So abnormal bleeding being that in between your menses, when you're having your menses, yes, that one is a normal form of bleeding, but in between your menses, you're not supposed to bleed, and you're having that. Or after sexual intercourse, during sexual intercourse, you're bleeding. That's abnormal. You're not supposed to bleed. So these are all some of the things that occur before, someone that pushes people to come to the hospital. But at that point, it may be too late. So let's get screened. Yeah,
I like that. Now, common misconceptions that people have. Firstly, that it's painful. To get screened or to get tested.
It's not. Yeah.
Okay, what other kinds have you heard that you go, why do people say this?
Yeah, that maybe it's inherited, or if you touch a patient who has it, you also get it.
Really?
Yeah, a whole lot of things.
Wow.
People don't want to, once they get to know that this person has cancer, then I don't want to get close. Maybe once I get close, I may get it. No, every cancer and the way in which you can get it. Some are genetics, some are, through HPV infection, persistent HPV infection like cervical cancer that we are talking about. So these are all misconceptions that needs to be dispelled.
Okay. Well, if you're just tuning in, we're talking about our Self-Care 101, how to take charge of your cervical health. Talking on cervical cancer. Dr. Lawrencia Serwaa Manu is my guest in studio. She's an obstetrician and gynecologist. And now let's talk about how our nutrition, our health also plays a role in how our cervical health can progress, really. Is there certain kind of nutrition or exercising that we need to do to ensure that we are in tip-top shape even when it comes to our cervical health?
Yeah. So nutrition and exercise cannot be overemphasized. I think it's important for general health, not just cervical cancer. But what is very particular when it comes to cervical cancer is eating food that is rich in antioxidants. So food that contain vitamin A, C, and E are very important, and mainly these are fruits and vegetables, and then reducing processed food. That is also very important. I think it's creeping into our part of the world. It didn't used to be like that a few years ago. And then when it comes to exercise, keeping healthy, everybody needs to exercise. So not just for cervical health, but for general health. And this kind of increases or boosts your immunity, because we speak of cervical cancer as an immune problem. If you have good immunity, you get infected with HPV, your body is likely to shed it, and it does not persist to cause problems in future, 10, 15 years down the line. So it's important to eat healthy, balanced meals and then to exercise regularly.
I like that. And speaking of exercise, inviting you all to join us for our Fit Start, 3FM Fit Start, happening on the 1st of February, this Saturday. We're all gathering at the Aviation Social Center to start off what will be a very exciting opportunity to get our health right. So start your year right with Fit Start Walk. Start point is Aviation Social Center, and end point as well, Aviation Social Center. Come exercise, network, and most importantly, chill. We start from 5:30 a.m. 5:30 a.m. So if you have the kappa, no, in fact, you don't even need to have the kappa. You can do it to the point where you are tired and you rest. We'll have a car for you that you can sit inside. But call us 0532200927. That's 0532200927 or 0532300927. That's 0532300927. And you can start off your year right with 3FM Fit Start Walk. happening this Saturday, the 1st of February 2025. Time 5:30 a.m. Just call us for more details or just meet us at Aviation Social Center. Let's start off the year right. Let's make a promise to ourselves to be tip-top shape and tip-top health in 2025. But Doc, thank you so much for coming through, for speaking to us, for sharing all of this. Your final words before I let you go, and how people can also reach out, perhaps social media handles also, where those that want to reach out and maybe get a bit more details can.
Okay, yeah. So basically, just as I said, we should be responsible for our health as women. Let's get screened. Let's use the opportunity to get the, free screening this month. Free screening going on in a lot of places. Let's get screened. Just walk into any place and then ask whether they have these services.
Yeah.
Let's get screened.
Yeah.
And you see, one thing too is that when you get screened this year, it doesn't mean that you have to screen every year. Or if you screened last year and it was normal, all you need to do is what? Wait 3 years, depending on what you did. If you did HPV DNA testing and it was normal, your next screening is in 5 years.
Really?
Yes. So it's not a yearly thing. If you did it last year, you don't have to do it this year. But if you did just a pap smear, which was normal, then you're advised to do it 3 yearly, so in 3 years' time. So let's use the opportunity. Let's take, our health into our hands and get screened. It's very important. And of course, those who have the means should also try and vaccinate their children against the HPV virus. It's important. Yeah.
I love that. Well, Doc, thank you so much for coming through. I had the most fabulous conversation on all the reasons why we should be taking our cervical health very, very seriously and exactly what to do to maintain that. The very wonderful Dr. Lawrencia Serwaa Manu was my guest. He's an obstetrician and a gynecologist talking about HPV, cervical cancer, and most importantly, how to ensure our cervical health is tip-top shape in 2025. Make sure you go and screen either the HPV DNA testing or the pap smear to ensure that you know. And once you are tested, everything gives you the all clear, then you can get your vaccine. If not, there are treatment options available. A lot of people think that you can't think of treatment, but there's treatment options available that are actually minimum pain, and you can be able to get in and out and go ahead with your life knowing that you are cancer-free without even letting it progress to cancer at all. And that's most importantly, prevention is always better than cure. It's always better than cure. I'm definitely going to be doing my testing this week. I will definitely pass by and do a testing this week, just so that I know that I'm good and I can walk around with confidence. Yeah. So please make sure that you join the bandwagon and also get tested. It will definitely serve you and all those that love you. We're going to get back into more great music and going on to the next one from P Square. No One Like You.